then you get that.
Right. Okay, so then let me go ahead and get set up for live here in just a second. There'll be a little thing up in the top left of your corner of your Zoom that'll say like going live. It'll be like a red little blinking light.
Oh, I see that.
So let me get this pulled up. And perfect. Awesome. We are live. So good evening. Thanks for tuning in to another episode of JeffCo Health Matters, where we discuss the health matters that matter to our health here in Jefferson County. My name is Brianne, Public Communications Officer with the Jefferson County Health Department. And tonight we're going to be talking about one of our newer programs that we're really excited about. It's in partnership with the Foxy School District. And I'm actually joined by Adam from our community health team, who you might recognize from some of our Spring into Wellness activity videos if you've participated in any of those. Adam was one of the lead people there leading those exercises and stuff. So Adam, thanks for joining. Can you introduce yourself and tell us a little bit about what you do at the health department?
Yeah, sure. Well, yeah, thanks for having me on this evening. I'm excited to chat health and nutrition, all that fun stuff. I am the community engagement team lead for the health network of the health department, and with that comes a variety of different things that I do. I'm kind of all over the place a little bit. We're work with the schools on anything health related, anything that they would like to see done, as well as stuff that's in the community. So community health programs, and then kind of the final portion is also kind of that assessment side. So helping with the community health needs assessment when that stuff comes up. So my day is always something different and always something fun. So I love it.
Yeah, for sure. So let's just like jump right into our topic, because I'm super excited about this one. I know you've probably got to be super excited about this.
Yes.
So we didn't have an official name for this program when we put out the teaser for this episode.
Right.
We didn't really know what to call it yet. So without an official name, tell us what is this program that you guys have been working on?
Yeah. So yeah, that's tough because we were even thinking about it. We're not really sure. Super summer camp program thing. So it's basically a collaboration with the Fox School District, and they call it their Character Kids Club, and it's a summer camp that runs following their summer school program. And so really what it is we're going to be coming in the mornings during that 6 weeks to kind of supplement their activities that they're already doing, specifically during their sports camp that they have. And so what we're doing is we're going to be gearing the program more towards that 3rd and 4th grade level and that 5th and 6th grade level, really taking a lot of our evidence-based programs that we already have, combining them all together and kind of making a whole health approach to the program. So it'll include a lot of physical activity. It'll include those nutrition and healthy lifestyle education pieces, as well as, intertwining into that mental emotional health components as well. We want to keep it fun. We want to keep it engaging for everybody. And it starts actually next week. So it's coming up really quick.
Right.
Yes.
Yeah. So it definitely sounds like a really cool program. I know that this has been a journey for you and your team to like get to this point and start like collaborating with school districts and being able to implement these different types of programs to work on our goals. So can you tell us a little bit about like why we do this program, why this kind of kickstarted, or why it's important?
Yeah. So it's kind of twofold. I would say the first part is we are under a maternal and child health grant that we receive each year, and the current main priority health issue that we're working under with this grant is to reduce childhood obesity. And to do that, we're going to try and increase physical activity and nutritional education in the youth in Jefferson County. specifically geared toward ages 6 to 11. So that's kind of the first part. That's kind of what sent us down this road of trying to, work with the youth to increase their knowledge and their physical activity. The second component is when working with school districts, we're very involved with what we do, but a lot of times it's for a short amount of time. So we do quick presentations. We're in the schools a lot, but we might not see the same kids all the time. And so with this collaboration, we're super excited because we'll be able to see them, for that 5 or that 6 weeks, over that longer period of time where we're able to build, hopefully build those health behaviors and see kind of a larger impact. So that's kind of a really cool aspect of it that we're really excited about.
Yeah, and I know I just thought of this like while you were explaining it too, but so you were talking about how it's whole health and we're looking at like mental, emotional, as well as physical. So in addition to being able to spend a couple of weeks with the same kiddos and really reinforce those skills, you're also able to build relationships with kiddos, which we know, like being able to have successful relationships with like adults and being able to have relationships with like camp counselors and teachers and things.
Yes.
Super important to like emotional and mental health for kiddos as well. And especially after the year we've had, like,
yes,
create those stable relationships and, things like that. I think that's really great. That just kind of came to me while you were talking about it.
No, absolutely. Yeah.
You guys thought of
fits in
everything.
perfectly. Yeah.
So how did this project come about? Because like you said, we have the grant and stuff, but how did this particular, like working with Fox, how did that come about?
Yeah, it's one of those things that it was literally pure coincidence. We had the director of the summer program reached out to us looking for just general resources to be able to implement into the summer program. They were looking at ways to increase the healthy lifestyle, the nutrition, education, things like that in their summer camps. And it was like, wow, we have something already made. We have piloted this specific program, at Hillsborough Elementary School before the pandemic happened. So we know that it works. And so we're like, wow, this really just fits perfectly in. And it allowed us to have a little bit more time. So the before school program was only for 45 minutes and we'll have 2.5 hours every morning with the kiddos. So, really being able to take that and then take that next step and expand to really see how much of an impact we can make. So, yeah, I mean, we couldn't have planned it better if we wanted to. So it's
2.5 hours every day, man. You guys are gonna be really tired.
I'm gonna be in great shape. That's the way I'm looking at it. Yep, in July.
Yeah, I was a teacher before this, and like teaching and being like kiddos, man. I would come home after the first couple of days of like a new school year and just be like zonked. So, get some rest in on those.
Yes.
Wear you down for sure.
I think the teachers are pretty excited too to have us
right.
Them,
back up.
That is very true.
That's funny. So we may have some parents of kiddos that are in this program or going to be in this program, I should say, who may be listening to this segment and well, this sounds kind of cool. What can I expect as a parent, or what can my kiddos expect? So what do you have for that?
Yeah, so I guess to get into a little bit more detail, we are going to be doing the 3rd and 4th graders. Like I said, we'll be doing them Monday, Wednesday, and Fridays in the mornings from like 8 to 10:30. And then Tuesdays and Thursdays will be 5th and 6th graders. So we're kind of breaking it up a little bit that way. And a little bit more into the program. So we've got kind of some main components. So the first main component, of course, is physical activity. We're not just going to be necessarily just playing games just to play games. We're going to be very, pointed on what we're trying to work towards. And the biggest thing is physical literacy and confidence. We want to be able to get these kids to be more confident to try those physical activities, to have them say, hey, well, I can jump, I can catch, I can throw, so I can put that together to play a game. So through kind of some different activities and fun games, we're going to try and help increase that confidence over the 6 weeks.
Right.
So the next component, which goes hand in hand, with physical activity, is that nutritional education. So each class, we will end it with some sort of nutrition segment. We have our dietitian that will be kind of leading those and kind of taking those on, as well as just the general summer safety stuff. So,
Right.
bike safety, sun safety, water safety, really trying to hone in that, this is kind of that holistic aspect of, we can't just go and exercise every day and expect to be a healthy person. We've got to kind of bring it all together.
Right.
And then, of course, that final piece is, working towards that mindfulness and the emotional health. We'll be doing that with kind of just short intertwined breaks, doing, kind of short meditation or yoga, or, kind of that coping skills and things like that, just kind of getting them to be a little bit more used to that sort of language and thinking about that way.
Right.
And then I would
Yeah.
say the final big piece, and especially towards the parents, is we want to have them engaged as well. So throughout the whole time, the teachers that are there will be, being able to take pictures or videos of the kiddos, sending it back to them and saying, hey, this is what we worked on today. This is what we learned. And then the kids are actually going to have some homework that they'll come back to and, say, hey, we want to try this out as a family, either a family activity or,
That's
go
cool.
grocery shopping together and, be able to kind of start making those health decisions as a family. So
That's cool.
that's, I think, will be pretty excited. That aspect of really that parent engagement. Yeah.
Yeah, for sure. That would be pretty cool. Going back to what you were talking about, like the focused breathing or like the stress coping, and we need to implement something like that, like here with employees. Like we need like an hour to just go run all
Yes.
together and then do some
Get it. We need to get it on the intercom where everyone, okay, we've got a
right.
meditation 10
Inhale,
minutes.
exhale.
Yes.
I dare you to try it, see what happens.
I will try it.
Oh man. Okay. So we kind of just chatted a little bit about it. You kind of touched on it, but we used the word whole health a couple times. And so when we were kind of
Yeah.
episode, there was a little bit of confusion sometimes with like, what is whole health? Because honestly, it's a super general term. So in
Right.
respect to what we were just chatting about and what you were just kind of highlighting, what do we build on as this concept of whole health?
Right. So I guess we know that when we say being healthy, we usually think of it as, getting exercise and eating right.
Right.
Well, especially with this whole last year happening, we're really being more. It's more and more important that component of health includes mental or emotional health.
For sure.
It is a very important aspect, and so in all of our programs, we're going to be very focused on including those sort of things. So helping kids or even adults being able to kind of understand, be able to express and manage your emotions so that you can better communicate. And for the kiddos, that's better communicating with their peers, with their teachers, with their families, being able to better, kind of describe what they're feeling, and take that and hopefully, cope with stresses, be able to calm down on their own, just kind of as some
Right.
examples to that.
Right.
But that's kind of that whole health aspect that hopefully we'll be able to integrate into kind of all the education
Yeah.
programs we have.
Absolutely. I think that's so amazing. And one of the very first episode we did of JeffCo Health Matters was with Brittany Castnar, the Provident counselor.
Yes.
Really hit home on like mental health and how it's important to just recognize emotions and be able to just talk about them and understand how to cope with them and knowing your own strategies. So
Yeah.
we think of that as an adult, but sometimes it doesn't always we don't always think like, oh, this is stuff that you think, yeah, we should definitely
Right.
kids, but it's different. So that's kind of cool that that's just kind of incorporated. So it's more normalized, because that was really a lot of the conversation was normalizing mental health. So
yes, absolutely.
So some people may be listening to this and they're going, wow, this sounds like really great. But my kiddos don't go to Fox school districts. So
right.
how do we get this in our district, or like, how do we learn more information, or how do we, present this? So what do you tell them?
Well, I mean, yeah, we would love to be in all the school districts for sure, you know?
You'd be
Um,
very tired, very
yes, yes.
tired.
Even if it's, even if that means us helping train the teachers or whatever
Right.
that looks like, we do have a lot of pilot programs that, this kind of kicks it off. But in any case, if you have something that say this would really work, for a program that my district is already doing or something like that,
Mhm.
please reach out, to the whoever runs that or the school administration, and tell them to get in touch with us. We would love to chat with them and work with them on how we can expand, that the health behaviors, throughout the whole district.
Right.
I
Yeah.
know I know it's with it. We only can do so much, but I think, we've got something magical here that I think we could
Right.
expand, to other schools. So
Well, and that's kind of part of, and that kind of like loops into what else we wanted to touch on, but that's kind of part of the MCH grant. I mean, that's very,
yeah,
we've been talking MCH,
yeah,
so like we're very familiar with this concept. Um,
yeah.
but you have to work towards a goal. You have to pick a goal, and then you want to actually work towards it with meaningful activities and things that are actually
Yes.
different. And I think you guys have absolutely nailed it with like the Spring into Wellness and this program. Like, I'm
Yeah,
so psyched to be partnering with you guys, like as communications, just to like help,
yeah.
because they're so fantastic. But this is
Oh,
just,
it's so fun
so
too.
like MCH is really great. It's big. It's a funding source for us, but it also has
Yeah.
to make a huge impact in our
Mhm.
community, particularly our kiddos.
Yeah, yeah.
So what other things do you guys have like going on with the MCH grant? Because you guys do a phenomenal job.
Right, right. So, looking back on some of the things that we've done in the past that are still going on, especially around the summertime, I would say, a few years back we partnered with all the county libraries and city libraries as well, to kind of beef up and expand their physical activity kits. So they have kits that you can check out, especially now it's the middle of the summer. You're looking for things to do. You're trying to get your kids
Yep.
out of the house, and you can check those out. We've got, I mean, the games are all over the place. They've got super fun different games. We've got one, probably the best one
Please
is
talk
is
about this one.
it's called, Chuck the Chicken.
Yeah.
So literally, it's a bucket with rubber chickens, and you play it by tossing it in. And if you miss, you have to do some sort of physical activity. So that's like you want to make it in, but it is
Right.
so fun that you can make it as hard or as easy as you'd like it. But that's definitely my favorite.
When you guys were coming up with those buckets, like the kits and stuff like that, I remember we were testing out some of the games.
They were
Chuck the
so
chicken one
fun.
was the best one to test out. That was awesome. And you guys brought it to a couple, I remember going to one of the Northwest Library events, I think, and watching these kids
Yep.
chuck the chicken. So that's pretty
Oh, they love it. Yeah. So I mean, I would totally say, go check those out.
for sure.
Some other programs, we mentioned the Spring in the Wellness is just wrapping up. We'll be looking to maybe do another one like that. It's kind of a community activity challenge. Um, and we're hopefully having something kind of build off of that program, with the county parks, putting in some fun stuff with their walking trails.
Right.
So be looking out for that. That will be coming up here pretty soon as well. Um,
Yeah.
but yeah, we're always doing something fun, and and we enjoy it too. I love playing with all, getting to see, really the kiddos' faces light up when we come. It's always a blast.
Right. Yeah. I mean, who doesn't want to play Chuck the Chicken?
It is, yeah,
When
it
you
is
show up with a
fun.
bunch of rubber chickens, kids are like, okay, wait, what's up?
Yes. And we've talked
uh,
about expanding it, we getting like rubber pigs and
oh
other
my
things.
gosh.
But yeah, then we're getting a little crazy, but
If there was a public health magazine, we should make the cover for that. That would be hilarious.
yes, yes.
Oh my gosh. Okay, so that was kind of the main things that we wanted to talk about. But I wanted to check our chat because it looks like we actually have one comment / question. So it says 2.5 hours before school. Can you imagine these kiddos there 2.5 hours before school and then after school too. So this is super sad unless I'm misunderstanding. So I think there might be a misunderstanding there because this is the summer school program. This is actually a piece of the camp. So if your kiddo is signed up for camp,
Right.
a piece of that time at camp is what's the word? Like facilitated by us.
Yes. Yeah.
Okay.
Yeah.
So we're not keeping kids 2.5 hours before school. I don't think we have the strength for that.
Yeah. No.
Yeah.
So this it'll be in the morning to keep it cool.
Right,
we
for sure.
Outside. And so it'll go from that 8 to 10:30. And we've got lots of transition periods in time, so it's not going to be all physical activity the whole time. So that's one piece. But no, we're not having them get there at 6 a.m.
Right. This is a piece of the camp. It's like a section of the camp. So, okay. Yeah. That's a really good clarifier.
Yeah. So our before school that we did with Hillsborough Elementary School, it was just that 45 minutes before school.
Right.
And so they were able to show up and then go right into, if they needed to get breakfast or anything like that. So that's probably where that confusion came from.
Yeah. Because that's how that originally started. And as like a former teacher's kid who got to school early because my mom was a teacher, that program would have been awesome because then I went to my mom's class or, and like watch them. So I totally get it. We had another question here that just came in that says, can we please discuss the partnership with Fox? So we kind of touched on that a little bit about how they had reached out for some resources and we had said we've got this program, they were really interested. And we kind of got together with them.
Yeah.
I'm not sure what the specifics are on that question. If that person can clarify in the comments, we can definitely try to answer that one.
But it's one of the things where, so the teachers will be there the whole time. So they were going to be there already, and we're just kind of coming in almost like outside presenters.
Right.
But we were able to work with them to just come, throughout the entire camp. So that's one of the biggest things is we will have teachers there, and we've gone through the whole background information. So we all have background checks, all that stuff as well.
Good to highlight.
Yeah. So that's kind of where, and it just, I would say in the last maybe 2 or 3 months, it's kind of a new thing. And this is the first time we've ever done the summer camp with them. So it's all pretty new.
It looks like this person clarified. So because you were talking about yourselves when I jumped on. Okay. So yes, you may have kind of come in when we started talking about the program. So basically we were just kind of like highlighting the this new program and what we're working on, and the fact that Fox School District is awesome and kind of letting us pilot this because this is the first time we've done it as a summer camp kind of thing.
Right.
So we're able to work with them and hopefully, I think it's going to be good. I think the kids are going to like it. It's something different. And like you said, it's part of a summer camp. So it's not like a before school or an after school thing.
Right.
It's just another fun activity to add on to a camp and something different. So, okay. I think that was it. Didn't look like there were many other comments. And we're almost kind of hitting our time anyway. So if there's any other questions or comments, you guys can continue to put them down in the chat or in the comment stream and we'll get to them. We are pretty much hitting that segment time. So I want to thank you, Adam, for joining. Discussing this new program. We're pretty excited about it. We'll definitely have to, and I'm sure we'll have some updates that we'll post on our socials and stuff about how the program's going. So we can definitely continue to post that. Our next episode of JeffCo Health Matters is actually going to be on July 14th. And I'm hoping that we're going to chat vector program, which is our mosquito program, but I still had to work on final details with that one. So keep posted and we'll get to that information. If you have suggestions for future topics or if there's segments or programs of the health department that you want to learn more about, you can always drop that information in the comments and we can see if we can put together an episode on that to kind of get more information to the public. Or you can always send us an email at communications@jeffcohealth.org. So thanks for joining us. Thanks, Adam, for joining us. And everyone have a good evening.
Thanks for having me.
Thanks.